Hey everyone, welcome back to the channel. Today, we're going to talk about the nursing care plan for myocardial infarction, or what most people know as a heart attack. We'll start with a quick look at the background and key concepts, and then go through a realistic case study to help you understand how to apply it in practice. So grab your notes, and let's get started. Let's quickly go over what's actually happening inside the body during a myocardial infarction, or AMI. Think of your heart like a car engine. It needs a steady flow of fuel to keep running smoothly. In this case, the fuel is oxygen-rich blood, and it's delivered to the heart muscle through the coronary arteries. Now, over time, things like high cholesterol, smoking, high blood pressure, and diabetes can cause fatty deposits, called plaque, to build up in those arteries. It's like dirt clogging the car's fuel line. The flow becomes restricted. If one of those plaques suddenly ruptures, the body tries to heal it, but instead forms a blood clot that can completely block the artery. When that happens, blood can't reach part of the heart muscle, and that part starts to get damaged due to lack of oxygen. That's what we call a heart attack. Now, I'll walk you through a clear nursing care plan checklist you can actually use in your clinical practice or simulation assignments. So, what do we as nurses need to look out for? Here are the key assessment points. Once we've done our assessment and confirmed it's an MI, our main goal is to protect the heart, relieve pain, and prevent complications. First, pain relief. Chest pain is the main symptom, and it tells us that the heart muscle isn't getting enough oxygen. Our goal is to reduce that pain quickly, because if the pain goes away, it often means blood flow is improving. Next is improving perfusion, or simply, helping the heart get enough blood. Once the patient is stable, we shift our focus to prevention. We want to stop another heart attack from happening. Let's look at a real-life case study so you can practice making your own nursing care plan for a patient with myocardial infarction or heart attack. Using this case, create your own nursing care plan, trying to think through each step of the nursing process. Think about what nursing diagnoses are most important. What short-term and long-term goals would you set? What interventions would you prioritize? And why? Remember to base your plan on the nursing process. And don't forget to include rationales for each intervention. That's what shows your critical thinking as a nurse. Pause the video now and write your nursing care plan in the comments below. Or, if you're watching this as part of your study group, discuss what you would do first and why.